Absolutely. Let me bring in some of the callers. We have them piling up here at 202-319-7810. That's 319-7810, or toll free at 855-288-4876, 855-288-4876. Jeff calling in from Baltimore. Good evening. What's your question tonight?
Oh, I thought I would have a question, but I was listening to this brother speak, and I got to tell you, I also suffer from sleep apnea. And I would just tell your listeners out there, for a very, very long time, the same thing with me. I'd be driving, and if I stop moving for a moment, I'm asleep.
Okay, so let me ask you this. Mm-hmm. What are you going to do about it? Have you done anything about it, Jeff?
What I did, I decided, I had to deal with this, and so I had a study done, and they did it in my home. They hooked me up to about 30 or 50 electrodes and some other device. In the morning, the nurse came back in, and when they read it, I think I had over 100 and something interruptions in my sleep. I stopped breathing that number of times. Mm-hmm. So that enough is enough to scare you, and so I'm using a CPAP device now. And I got to tell you, it was rough in the beginning, and I just want to let people know that you probably are looking at, if you contemplate getting treatment, you're looking at the old-fashioned mat that covers your face, and you're going to be uncomfortable.
Oh yeah, I'm going to have Dr. Kuperan talk more about that. Thank you so much, Jeff, for sharing your story and enlightening us. We really appreciate your call from Baltimore, Jeff. Thank you there. We're going to take a quick break, and we're going to come back and continue our discussion about sleep apnea. Do you have dark spots that won't go away? Are you tired of wearing makeup? Do you have unwanted hair and not sure if your skin type or color can be treated? There is a place where it's appropriate to treat people based on the color of their skin. It's called Cultura. Cultura is one of the world's top cosmetic dermatology and laser practices located in the Friendship Heights area of Washington, D.C. Cultura has over 30 cosmetic lasers to get rid of unwanted hair, moles, dark spots, acne scars, or dark circles, as well as Botox and skin tightening. For a complimentary skin analysis, call 202-237-9292. That's 202-237-9292. Or sign up online at culturamed.com. CULTURAMED.com. Imagine going out without makeup. At Cultura, we believe the need to wear makeup should be optional.
Medical insurance is not accepted for cosmetic services.
Welcome back, everyone, to the Daily Drum on Sirius XM Channel 141 and, of course, on WHUR. I'm Millette Green in for Harold Fisher this evening. Why are so many black people dying in their sleep tonight? Our discussion about sleep apnea continues with our guest this evening, Mark Clarke, host of the Hang Suite, who just found out just recently that he suffers from sleep apnea. And, of course, Dr. Sharmeela Kuperan, who is an adult sleep specialist with the Rest Assured Sleep Center. Dr. Kuperan, talk about this statistic here that I'm going to read. Almost 80% of blacks have common signs of obstructive sleep apnea. Obstructive sleep apnea is the most common sleeping disorder. Can you explain that?
So, correct. There's different kinds of sleep apnea, but obstructive sleep apnea is by far the most common because it's the most closely linked with weight and any kind of anatomical obstruction. So for adults, most commonly sleep apnea is caused by being overweight. So the treatment for sleep apnea in adults, a big part of that treatment that I urge all my patients to work on is weight loss, diet changes, lifestyle changes, increase their exercise. We can sometimes eliminate the sleep apnea just by doing that. With children, it can be a different story. A lot of times with children, it's usually due to problems with their tonsils or their adenoids. But, nowadays, even being overweight is becoming part of the cause of sleep apnea for children. That wasn't the case if you looked at the studies.
Well, yeah, we have an epidemic of children who are overweight. I mean, you're seeing it, and many people think it is normal for children to be a little heavy or to be chubby, and that's not normal.
Correct. If you looked at sleep apnea in children 10, 20 years ago, it was almost 100% due to their tonsils or their adenoids. You take out their tonsils, you take out their adenoids, you have cured their sleep apnea. That statistic is not the case anymore. It's still responsible for the majority of sleep apnea in children, but being overweight and obesity is unfortunately, becoming a much more common cause of sleep apnea in children. And just goes to the statement of we need to improve diet and lifestyle, not just for adults, but for children, too.
Yeah, my 3-year-old daughter, she's 4 now, but at 3, she had sleep apnea, and she had to have the tonsils, adenoids removed, solved the problem. She's not overweight, thank goodness, but the surgical procedure solved her issue, and she's sleeping so much better now.
Great.
Mark, you said you wanted to almost be sort of like a spokesperson for this condition. Here's the stat that I want you to address. Even when blacks have adequate insurance coverage, they're not likely as their white counterparts to utilize available services. We're not getting it done. We're not going and getting medical care for this.
Yes, I think there's definitely a gap. I think I still think there are certain feelings of distrust when it comes to medicine and doctors.
Taking this seriously. People don't think this is as serious as it is, right?
Well, I think that now something that resonated when I was talking with the people at WHUR, you talk about neck size, saying that if your neck's like 17 and a half inches, you can be susceptible for sleep apnea. That's why so many pro athletes, Shaq, there's a video of Shaq having the sleep study.
Mm-hmm.
Of course, I don't know if a lot of people know, but Reggie White, the NFL, the Hall of Famer, he pretty much died because he suffered from sleep apnea.
Mm-hmm.
A man who willed himself past injury after injury, but could not will himself past this disease, has pretty much snuck up and got him. And so I think the awareness, that's why I said, being a spokesperson, is making people aware of the seriousness of it. I think that's the important thing.
Absolutely.
I think when you hear people say, when you hear the diagnosis, how they decide it is that you are stopping breathing, and then
it's serious. It's serious.
I think that though. I think once you have that conversation with a doctor, I imagine, and maybe the doctor can address that after. Once people get in there and have the sleep study and have that conversation, don't they pretty much decide to get help? Or do you are you shocked by the number of people?
Hold on for 1 second. Hold on for 1 second, Mark. Dr. Kuperan, how can people get in touch with you?
The phone number for our center, and we have a few different centers, our phone number is 410-897-8445, and our website...
website.
Our website is www.myrestassured.com.
We need to take a break. If you're on the phone, hang on there. We're going to get to your call and continue this discussion on Sirius XM Channel 141 for our WHUR listeners. Up next, the original Quiet Storm with Jeff Brown. Up next.